Now let us talk about contrast media. So this contrast is water soluble and iodine based. So it's very important to check allergy to iodine or dye before undertaking ERCP. If they have allergy to iodine or dye, these patients need to be prepared with steroids, Benadryl, famotidine, etc. So let us look at how do you set up the contrast media, the back table setup, and how do you prepare your contrast. Here is the contrast media, and you pour the dye into a cup and then fill the syringes with the dye, followed by clearing any air bubbles and using a gauze to clean the dye from the tip of the syringe, and then labeling the syringes with a label. You apply a tape to the syringe and label the contents, date, time, and also make sure you put your initials. Finally, you also label the cup with the contents, date, time, and put your initials. This is very important for any solution that we use in the endoscopy unit. And place the contrast filled syringes in a kidney tray. So now you have a series of 10 cc syringes filled with dye, free from any air bubbles, and they're all ready. So how do you prepare your catheter before you give it to the endoscopist? This could be a simple double lumen catheter, or it could be a sphinctertome, or it could be a balloon, extraction balloon. So let us look at a double lumen catheter. A double lumen catheter has a guide wire port and a dye or contrast port. So you make sure that you don't inject dye into the guide wire port. That's very important. And you don't want to inject saline into a dye port. So the guide wire port should be flushed with saline, and this allows the guide wire to go in easily. And once you push the guide wire all the way to the end, and you make sure you clear the bubbles in the syringe and flush the contrast or injection port or dye port with the dye till you see that there are bubbles of dye coming out. What are the things that you should be careful when using contrast? Make sure you clear the bubbles in the syringe. Otherwise, if you inject bubbles into the bile duct, sometimes it becomes difficult to differentiate stones from bubbles. Although people can figure out if the bubbles are floating up or not, but you want to avoid that. And in order to avoid air coming in and injecting, always hold the syringe down. If in case air enters the syringe accidentally, the air floats up to the top and it avoids the risk of introducing into the catheter. So clear the bubbles in the syringe, and whenever you're injecting dye, you always want to hold the syringe down. So these are the most important things. When it comes to how do you inject dye when the endoscopist says inject dye, you should inject slowly and you should focus on what is happening on the fluoroscopy monitor to see whether the dye is going into the bile duct or the pancreatic duct. How do you know whether the dye is going into the pancreatic duct or the bile duct? The dye that goes into the pancreatic duct has branches in the head, body, and tail. Bile duct has no branches until the dye goes up into the liver. So if you see branches very early on with the injection, you know that it is a pancreatic duct. Pancreatic duct also crosses the spine as it goes towards the spleen. So if you see dye going and crossing the spine, you know that it is a pancreatic duct. On the other hand, bile duct has no branches in the initial segments, and then it crosses the scope. So and it goes up and crosses the scope. So another point is the pancreatic duct goes horizontally across the spine and has branches. Bile duct has no branches, goes up and crosses the scope. So here is the pancreatic duct and here is the bile duct. So let us look at as the bile duct goes up. As you can see, it is crossing the scope, going up into the liver. And let us label the different segments of the biliary system that you see on cholangiography. So the first section is the common bile duct. Then you have the cystic duct opening into the common bile duct from the gallbladder. And above the cystic duct insertion, the duct is known as common hepatic duct, and it branches into left and right hepatic duct, and they even branch further into various segments of left and right intrahepatic ducts. When you do a case and there is a stricture and there is a dilated segment above the stricture, before you inject dye, you always want to aspirate a bile so as to reduce the pressure before injection. You do not want to overfill the biliary system, especially in a patient with cholangitis, as that could precipitate septic shock. Next, what types of dyes do you use? How about a stricture case and a stone case? Is there a difference? When you deal with a stricture case, you want to define the stricture, and in that case, you want to use an undiluted contrast. You take it straight without dilution. On the other hand, if you are dealing with a stone case, then you want to use a diluted contrast. And your endoscopist will tell you how much dilution he wants, and with the help you could figure out how much dilution you want to make. It's also important when you're dealing with a stone case to avoid injection of too much of contrast, as too much of contrast tends to obscure the stones. So something important to keep in mind. And we have learned over the years that contrast injection into the pancreatic duct repeatedly can precipitate pancreatitis. Hence, most of us have moved away from contrast injection and try to get into the bile duct using wire-guided cannulation. And that is shown to be helpful. So, important to keep in mind whether you want to do contrast injection or wire-guided cannulation when trying to do an ERCP. In high-risk cases, it's a good idea to go with wire-guided cannulation. And once you're in the bile duct, then you can inject contrast. I hope this is helpful. Thank you.